Okay, so now we're going to do the thoracic spine. It's an AP, lateral, and then what's called a swimmer's view. I'll show you what those three are. Again, once you get good at it, you just kind of roll with these. But I'll show you. All right, so I'm going to turn the light on here. Be careful whenever you get up higher. That light will blind folks. So always make sure they're straight on the table again. So Jill is pretty well squared up, I think. I like that. You know, even I almost always adjust everything, so whether it was helpful or not. So on a T-spine, typically your starting point for centering is you're going to have a little bit of light above the shoulders, basically. Or if you look here right across, on a guy would be where the Adam's apple's at. That's about where the top of your light is. You want to be mid-sagittal plane, and you want to cone in. And so for this one, you have to include T1 to T12. So that is quite a bit of range, if you will. Let me see. The technical centering on this is you want to be at the level of T7, which is midway between the jugular notch and the xiphoid tip, which I won't palpate on a female, but jugular notch is here. The xiphoid's in there, and for guys it's real easy to do. That's about where you want to be centered between. And so right about there on Jill is what I would say. So that's going to give me T1 to T7. Beep. We're done. On the lateral, it's a little bit different. So we'll go ahead and do that. Roll up on your side if you would. Okay. Left. Sorry. By convention, you almost always do left laterals, but sometimes you could do a right. And if they can't lay on their left for some reason, it won't make that big of a difference. And then you kind of, all right, so stack your arms like you're praying again. Bring your knees on top of each other. And then I have to shift her again. It's even more important, elbows up a little higher, on the T-spine that the shoulders be squared up, because that's really the area you're looking at, right? So for this one, your centering is going to be comparable, basically at the level of T7. So, but you need to look from the top, make sure the shoulders are nice and square. T7 is typically the inferior scapula margin, but that's a little low on Jill. So I wouldn't center there for her, but I would come down some. Remember, we have beam divergence. So though there's light here, the cassette's all the way up to here. So we have most of that. And then again, I know L4 is here. 3, 2, 1. So I know I'm into the lumbar spine because I see her anatomy as a whole, not just what I'm looking at. I'm good there. And then you really just want to see, where am I going to hit the vertebral body? You know the vertebral body is anterior to the spinous process, right? And on most people, you can kind of feel or see spinous process on her T-spine there. So the body's right about there. I think the test may have you going, it's not quite mid-coronal, but just kind of eyeball it. You're solid. Everything in your book's a starting point, so that's all you really get from that, and the rest is just kind of what you learn through experience, and that's what we do so much practice. So that would basically be your lateral. You do that with a breathing technique, which you will learn about. But let me give you a side view of that. Right there. So not quite at the inferior border of the scapula, but that's kind of what you're looking at when you do this one. All right, and now we'll do the swimmers, which is a little awkward for the patient, but it's a pretty neat view. So I always do about 5 degrees caudal, okay? And it's on a 10 by 12. Swap those puppies. Again, if it's DR, you know, you just collimate, so that's nice. So I may have to scoot her down on the table again. Scoot way down for me, Joe. Right there, one more little scoot. Perfect. So whenever you have to adjust the patient, overcompensate so you can have a little more play. So what I do with this is I'm gonna steal your pillow from you. Okay. Then I'm gonna have you reach your left arm way above your head. I'm gonna put this pillow between you and your arm, and you can lay your head like that. And your right arm reaches down. So what the goal is with this particular image is to center at C7T1, because the shoulders usually block off those top few thoracic vertebrae. So I want to be For vertebral prominence, I want is C7, right? And T1 is what I want to include. And by separating the shoulders, what I've done is open up a space here that's going to show up on the radiograph. Pretty nice. So that's your swimmers, basically. You do this for a cervical series too when you can't get C7 or the top of T1. So what you do is you kind of center this way and say, all right, I need you to blow your breath all the way out. Now with one hand, I want you to reach for the ceiling with the left and reach for your toes, not the ceiling, but the wall. There you go, just like that. Have them separate, hold their breath out, beep, go ahead and relax. And that opens up that space just a little bit more. So that is your swimmers, pretty easy.